So in releasing the tissues down the front line, myofascial line, which also interestingly correlates to the pericardium and meridian in Chinese medicine. Use the flat of the hand, not poking, so it's like gliding tissues, dauphinoise potatoes, as I sometimes say, or the layers of a book. It's a shear force. So we put the flat of the hand, very slight curling of the fingertips perhaps, and explore the area around the top of the pectorals, from the collarbone down to the top of the upper breast area and chest area. Create contact with the skin and traction it one way. Find an area where you feel there's either a limitation and or tenderness. But for me, there's a little bit of restriction there. Glide, hold that glide. It's not about continuing to push and push and push and push and push. It's take up some tension and wait. You might feel it give slightly and soften under the fingers or under the skin. And then you can try in different directions. 12 o'clock, 6 o'clock, 9 o'clock, 3 o'clock, 2 o'clock, or even a slight twist. Wait for that to give. Then come down through into the front of the deltoid area here. Same principle. Same principle through the front and inner side of the biceps muscle area here. Best if the arm is relaxed down doing this. So here, find a point perhaps that feels blocked, limited, tender. Apply a traction, a shear force through it. And you can even come down. Even though the restrictions, your pain may be here, you might well find that there's a restriction here that's pulling all the way down the limb and limiting your movement. So once you've released and spent 5 or 10 minutes just doing some release through that line, then retest with that horizontal movement there or arm up there. And if it feels improved, then fantastic. Tells us that we've released some of the tissues limiting that section of the body.